Welcome to our Tuesday night chat. I'm Kelly Wilkins from My Self Reliance, and it's so good to be with you tonight. I had this question asked of me, and I'm going to share it with you now. Why do we call it the Tuesday night chat? Well, this is the place where we all get together to get to know one another. It's really a place where we can converse and talk. And so, before the conversation begins with our guest speaker, we get to know one another in the room. And so next year, I'm going to make it a big announcement that next year we're going from having a guest speaker every week to having a guest speaker every other week, so that in the in-between weeks, we can actually just get together as hubs and hub leaders and really make strategic plans for how we're going to move forward together in our hubs. And so if you have jumped on and become a My Self Reliance member, you get special access to the Freedom Summit that's coming up in October, to spend time with our hub leaders, with our guest speakers, with our experts in our 7 pillars of self reliance. And so I know a lot of people who are joining us tonight are brand new to My Self Reliance. So our 7 pillars are food, finances, health, education, relationships, technology, communication, and our latest addition, so it's 8 pillars, is faith. And so with those pillars, we make sure that we address each of those areas at our Tuesday nights, our in-person events, and really helping people become resilient in all of those areas. And so we use what we call the PrEP matrix. So P is for the problem, R is for the resources, E is for education, and P is for people. So we apply the PrEP matrix across all those 8 areas to really help people know where to begin in their own journey of self-reliance. And so I invite you, if you're just tuning in and you're finding out what is My Self-Reliance, to come along to our Freedom Summit held in Kenthurst from the 24th to the 26th of October, and really discover everything that we have on offer at it, and meet people who are like-minded and really wanting to support you in as much as you're ready to get going on your own self-reliance journey. So without further ado, I want to introduce our guest speaker tonight. And I am super excited to have with us Dr. Simone Sleep. She's a scientist, a clinician, and a biological oral health consultant with nearly 20 years of experience. She's found Pathocell Diagnostics, I hope I've said that right, to address hidden links between dental procedures and chronic health issues. Her work has been featured on Channel 7 and Channel 9. She's passionate about reducing harm, restoring health, and educating Australians about overlooked risks and even things like parasites that are impacting oral health and overall well-being. So thank you so much for being here. Simone, it's lovely to have you.
Thank you so much, Kelly, for inviting me on tonight to your group and to share my personal experience, as well as to share what I've seen in clinical practice for 20 odd years. So thank you so much. It means a lot to me. It's a passion for me to help people in this area. So I'll just share my screen so I can bring up my presentation here.
Oh, yeah.
So yeah, that'd be great if we could. Okay, yeah. So thank you very much for your introduction, Kelly. The other thing that I'm having extra training in is the parasitology. So that is through QUT at the moment. A lot of training goes into that, obviously, to look at diagnostics and how we're going to identify dog parasites that are now becoming a major problem in Australia. But obviously we don't talk about it here in Australia. We're too busy. Also, during COVID, there was also a membership that was set up for healthcare professionals only, obviously because everyone was losing their association registration. And so out of desperation, the Disciples of Healing Ministry was set up as a private membership for practitioners only, so that we could converse, we could still provide services and completely stay out of the limelight while COVID was being pushed on to patients and to practitioners and having businesses shut down. So we had to come up with I guess, a plan of attack when that was happening. So we're all about being proactive and keep going regardless of what's going on around us. And out of that, a lab is being currently built and an educational model as well. So, just a quick overview of what the Disciple of Healing Ministry is. It is founded by myself and Patrick Horvath. I know his mother's on this. I'm hoping Patrick's listening tonight. So, Patrick and I have a platform where we wanted to support practitioners and also small businesses just in our local community. We can only do what we can do in our immediate area. And it was just obviously to create a circle of trust so that we could actually help people. So it is a private membership by association grounded in trust. And it was just to support micro businesses, especially the practitioners that had lost their business. It's also community infrastructure built as well, outside of any kind of government registration. Even for the naturopaths found that their associations were also pushing for the vaccine as a natural product. I just couldn't believe it. It was getting beyond crazy. And so we could see a lot of naturopaths crumbling under the stress and the pressure and having a vaccine that's totally against Mother Nature. So it really did put a dent into the natural therapy side of the industry. We also didn't get involved with the 501c3, if anyone's heard of that. It was all about not being subjected to any kind of man's code of law or anything like that. So we completely just went separate ways, I guess, building our own sandpit. And I guess we're inspired by a lot of people who had challenged the IRS and their overreach in America. We've seen what they've been able to achieve over there as healthcare professionals who don't need to be registered. So we're not a religious doctrine at all. You have a personal belief and that's a private thing. So it's just more, this is a community-based thing, helping our local community. This is going. Okay, so the hidden crisis in dentistry, it's like, what's next? I guess everyone's been going through understanding the medical industry, and now we're going to have to face the dental industry with the creation of what's happening here as well, and the medical harm that has been going on for a long time. If there's any
You've got a
dentists,
slideshow, so I'll take photos of it.
it's okay, Farmer Joshua. Yeah, okay. If
Well,
there's any dentists here or dental hygienists or anything like that, by all means, we have a lot of them wanting to do things differently in the dental chair, which is fantastic. So all of my training has come from biological dentists, and I do have a mentor in biological dentistry for over 25 years. And I have learnt a lot, especially from America, where dentists have had their own laboratories and doing a lot of testing for pathogens. So it's been a real eye opener for me to actually learn a lot. And I guess starting this pathway is always comes from a personal experience. And I've had a terrible personal experience with a root canal, a baby tooth that was filled with mercury fillings, a mouth full of mercury fillings. And to top it off, we'll put a dog parasite in there as well. And it explained a lot of sickness and cancer when I was diagnosed with cancer at the age of 27. And my journey started off in the dental chair, crying for 4 months. And I'd never forget this saying from my dentist, and he said, "Well, it's going to be death or vanity. Which one would you like?" So it was pretty rough at the age of 27 to face all of this and not really understand that, because as a naturopath too, my first love is always Mother Nature. we were not really discussing anything about teeth at all as part of the process when you do your assessment with your patients. So this is why it led me going back into studies as a biomedical scientist, straight into my PhD in dental research. So mercury's been around for a long time. The disagreements have been around since the 1700s, and it's just business. They did say we are not to put mercury in people's mouths, but obviously the business and the commercialization won, and somehow it sneaks through all the time. As you can see, root canals, implants, and infections are left unmonitored, and now we are faced with implantology now as big money. And the thing that they're trying to do at Griffith University is to try and find a way to stop little pathogens growing around the screw that they put into your living tissue, and to make it antibacterial or make it in a way so that the biofilm will not grow around there. But it's just a fruitless way of research and a waste of money, because anything that's prosthetic in living tissue, biofilm or pathogens love to grow around, these prosthetics. And what we're finding is that the dental procedures are triggering systemic disease that no one's really looking at. So this is a big problem. And currently, Griffith University is still using mercury amalgam in the student clinics. And these poor students are having to wear hazmat-like PPE in the lab, but then when they put it into the patient's not getting any protection at all. But, it's funny how you watch the students dress up in hazmat suits. It's just crazy. So the mission we've got for the laboratory, which is I got some personal funding for it to start purchasing a lot of equipment, and that was the first stage. And it's to create a dental pathology lab on private land and be community-based. So currently in Australia, we do not have a dental pathology lab that will go on and do PCR testing for about 88 individual microbes that has been found to cause damage if they go nasty in your mouth. There is nothing here in Australia. Currently, we are having to get dentists to remove the rotten tooth or the root canal, or even a cavitation, like just an infection patch, send it over to the US, and the lab over there called DNA Connections will do a PCR test and send back a report booklet to tell you how much of this pathogen is and whether this patient is suffering from a certain disease because of this. And please do not let them take a certain antibiotic because it is now resistant. So in Australia, you go to your dentist, and if you've got an infection, they will just give you a blanket antibiotic and hope to God it works. And the next thing is to raise awareness around the implants, because all these implants are coming out in the market. The manufacturer is not telling the truth that they now are excreting aluminium into your brain. And so even though the dentists are saying, this is great, the zirconia, it's safe, effective, and the porcelain, it's not going to be like, but all the bacteria and aluminium still comes out in it. And there's a paper, I should have put the paper up here, but there is a paper written, and that it's saying that the manufacturers are not being totally clear and being very vague on how they produce these petrochemical products that we put in our face. And definitely there's no, I guess, telling the client the exposure of long-term damage of dental infections and the toxicity from mercury fillings. There's no sitting you down and let's have a chat to you about all these fantastic products I have in my dentist clinic that I'm going to put in your face. And but let's just tell you that a lot of this stuff is toxic. They don't have to tell you that. There's going to be a massive change coming where I would love to see patients going into the dentistry with big long form and getting the dentist to sign off and say, I will reimburse you if I've damaged your health, because it's going to have to start somewhere. Also, currently the lab is providing for midwives access to biological supplies and care. So that is very vague and code for things that we can't get in current hospitals right now, because they're dictating to us what we can have and what we can't have. So we've set up a lab where we can get unvaxxed biological supplies if we need it. But we can't put it into the hospitals because they don't want it in the hospitals. So this is something that is on private land with a private, I guess, agreement for people who want to have different supplies if they need it for a health issue. So this is all purely community-based. It's ran by a community, and if something happens to me, the laboratory can still continue because it's ran by the community. That's how we want to keep it going. There's no point me saying, yes, I'm the boss and yes, I own this. We don't want that. We want the community to have access to equipment and have access to things that they need for healthcare. And so it's very important to why it matters. I guess why am I doing this is because mercury is a neurotoxin, and there's just no safe level of mercury, especially for the brain. It goes everywhere, really. We want to stop root canals altogether. It's just creating a mess in people's lives, and it's a mess for life. And these infections are now becoming resistant to antibiotics. And I'm going to show you a paper where it's a two-pronged problem with mercury and infection. Who's scared about the anaesthetics? Who's getting on to David Nixon about the anaesthetics and what's inside anaesthetics and the problems with graphene oxide? Because there's a lot of questions around, okay, what else have they been fiddling with our medicines? You know, because we're going to go for surgery in the hospitals. What else is going on with the medications? So there's a lot of concerns at the moment. And I guess no one's talking about dog parasites. And this is highly infectious. If you've got a family member who has a dog parasite, you kiss them on the cheek, or your spouse, you are cross-infecting your spouse. And also to anyone that's got a root canal, you're cross-infecting your spouse with all of that infection going to that other person. This is how bad it is, and how people just don't realise we are causing a lot of sickness between each other just in oral infections. And we want to really advance and improve the level of care for patients. That's what it's all about. And if I can get the local communities really up there with their education, then maybe we can change it from the bottom up. Because there's no point attacking the Australian Dental Association or the APRA or any of those people. I'd rather have the push come from the people, because it's what you want. It's how you would like to be treated in the dental chair and be safe and not have to be ruined for the rest of your life. Because once you've been touched by the dentist and you've had a root canal or you've had silver fillings, and yes, you might have removed it all, but you have to work so diligently for the rest of your life because the medical harm has been done. And see, these are the papers that are coming out, linking a lot of the dental amalgams with chronic illness and fatigue and depression and anxiety. And virtually everyone has some kind of response to mercury poisoning. Some people are not as sensitive and do not show as much. It's only when you do the really extensive functional pathology tests that you can see mercury levels going to their brain. Neurological problems are terrible. Emotional responses such as the depression and the anxiety. Who's irritable all the time? You know, unexplained irritability. I mean, I certainly put my hand up for that. facial twitches and muscle spasms and multiple sclerosis. That's just to name a few. The list just goes on and on. Mercury, if you ever go and Google the god Mercury, the Romans, and just, it is death. It is a slow breakdown of your body. And cardiovascular. So anyone that's got unexplained rapid heart rate or unidentified chest pains, you'll find Mercury will start to have an effect. And breakdown of your collagen. So arthritis, scleroderma, and lupus are a major problem from mercury poisoning. Immune problems, lowering the body's defense system. It also, you don't have a good stock of white blood cells for a strong, healthy, robust immune system. And who's suffering from allergies all the time and fatigue? Because one thing you got to know with mercury, it always drives your iron status down all the time. So people who have really poor iron are taking tablets, are trying to eat meat, but cannot seem to get their threshold up to the levels where they can feel good, is because mercury will always drive it down, and it will actually take oxygen out of your red blood cell. It is that deadly. So this is a experiment done, and this was done by Dr. Boyd Haley, and he put mercury into a sheep. So they put mercury fillings into the teeth of the sheep, and here they've done a scan, and you can actually see the black parts here of where the mercury's gone into the kidneys, into the liver, stomach area, and the jaw. That shows up in a scan. It just goes everywhere, and it is very destructive. So Dr. Boyd Haley had created a product called the OSR, an amazing product. I had one experience with it in 2010 with a patient who had unexplained beating of the heart, and it was the only thing that had slowed it right down, and he felt amazing after taking these capsules. The FDA came in and shut poor Boyd Haley's lab down for 9 days and said, "You're not making this," because children with autism after vaccine damage were overnight turning around, overnight. Now, it's amazing. He does tell you what he does to make this, and it is a natural product. It is completely non-toxic, but it's amazing how he, as a biochemist, was able to come up to produce a product that had 2 sulfur bonds that were sticking out, and it's all about the purification. It takes 21 hours straight in a lab to go through all the processing to make this product. And what it does, it goes everywhere. This product will float all through your blood-brain barrier, and it will attach to any kind of mercury that is sitting there active and drag it out through your bowel. So you do not have any kind of Hexheimer's reaction. You don't have any kind of, detoxing side effects or anything like that. It is amazing what this gentleman has produced. He's in his 80s now, and they call it now the purifying water product, and you can get it into Australia, but at the moment the postal system has shut down because of tariffs to Australia. And it's if you've got friends flying over there, you can pick it up and then bring it back to Australia if that's the way you want to do it. But at the moment, it is very hard to get anything sent from the US to Australia at the moment. So it does cost $800 US if you buy just one. You can buy it in packs of 10 to get it down in a cheaper price. So that's the website there. If you want to have a chat to Dr. David King, who is actually supplying the product. But it's amazing. I've seen people turn around in days from the symptoms of mercury poisoning, because it gets the glutathione levels back up straight away within a day. That's how fast it is. So there's nothing else on the market, nothing. So root canals, anyone that's sitting there with a root canal, this is what's going to happen to you where millions of people are undergoing these treatments just to keep a dead tooth in living tissue. And the bacteria from that infected tooth will always remain inside the tubules. See how you got those holes there? That's of a tooth. You got millions of these holes in the root of the tooth, and the bacteria can just hide in there. So every time you have an antibiotic or you do a parasite cleanse or you're doing something to, help yourself with the infection, these little critters will go and hide because it knows it's not going to die. They will survive, and they know how to survive by hiding in these little holes here. And then they'll come back out and play again once you've finished your treatment. It's terrible. This is why people can't get out of the cycle. And the reason why these are probably the most deadliest form of infection is because they are hydrogen sulfides. They come from cysteine or methionine. It is so deadly, this infection. I can't seem to express it with my words enough to get it through because people just don't see it enough or don't sit here and have enough discussion around this. But they spread throughout the body. Now, if anyone's seen the meridian tooth chart, you can Google it, and you can see that each tooth is lined up through the lymphatics through to the different organs of your body. So for a front tooth where I had my root canal, it was all lined up to the uterus, to the reproductive organs. So that's where I had my issues, my cancer. So as soon as they removed all the, that tooth actually flopped out. It was so rotten that they had to then shave back the bone because it was pretty much gangrene. So that's so deadly. And so as you can see here, it can link to many diseases. So those 88 different microbiomes that go nasty will decide which kind of cancer or what kind of disease you'll have. They are very specific to diseases. So here you can see one front tooth. The root has over 3 million holes. And you can't fill up these holes with a root canal with the gunk that they put in there. They just can't do all of those millions of holes. And what you can see here over time, if you do have the root canal, it increases the chronic inflammation and it decreases your immune function. And these over time lead to autoimmune disease, cancers, heart attacks, strokes, and rheumatoid arthritis. But what they've identified with the root canal, that there is 4 different species for your heart, there are 3 species for your nervous system, and there are 2 species for your kidneys and your brain that it attacks. And your maxillary sinus, there's 1 species that will go in there. So if you're having sinus problems all the time, it'll be good to check for that pathogen if you've got some kind of infection going on here. So just to quickly go over the anaesthetics with graphene oxide, these are the concerns. These images were taken from Dr. David Nixon, and he's been looking at these anaesthetics under the microscope. And as you can see, these beautiful, lovely gold square nanotechnology that's floating around and binding together and forming together and moving around and doing weird things. He's been watching that under a microscope. Now, there are only 30 microscopes in the world that can actually identify chemicals. He doesn't have it. So we're now left with, well, what the hell are we looking at if we don't know exactly what that is? Because manufacturing is not being honest, and we don't have the top-notch equipment to diagnose what's going on. So obviously, it's now coming out that there is graphene oxide and nanotechnology that's active in the anaesthetic. We're already facing over 700 chemicals in our system every day anyway, on top of having this. And what needs to be improved is our understanding of functional pathology with the tests. You can't do pathology tests that are assigned to a drug. You have to go back to basics with pathology to find out what's happening to the liver, what's happening to the kidney, what's happening to your cardiovascular. You need those kind of tests, just the basics, but know how to interpret them. That's what's lacking here for our education as practitioners. And then you've got to go for the unchecked toxins that greatly lower the threshold for dental disease and for systemic conditions. So a poor patient has so much to consider and go through and try to clean out with infection and toxicity. Now, the International Academy of Oral Medicine Toxicology came out through an email to all the members and said, we've checked 3 of the main anesthetics and we cannot find nanotechnology or graphene oxide in it. So here they are, but I mean, which companies did they check the anesthetic? That was our question. Which ones did you try? You know, did you try all the different manufacturing that make the same anesthetic to find who was the culprit? So that's the only thing that we're questioning at the moment, because we're not trusting anyone at the moment when it comes to medicine. And look, the laboratories that they use, different laboratories to test the anesthetic, could confirm that none of the samples had nanotechnology in it. And look, graphene oxide apparently is still being in its investigational stage and currently not approved to be used in anesthetic applications, because they're looking at graphene oxide as a prolonging the pain threshold, you know. So if you need longer time in the chair, you might need anesthetic that numbs the area a lot longer. And they do have bupivacaine that's commonly used for longer acting anesthetics, and they confirm that there's no graphene oxide in that. So now the fight's on. We don't believe you. We know what we're seeing. They're over here saying, well, we're testing it. We can't find it. And so we're still sitting in the middle going, I don't know. We just can't trust. So just for our dog lovers out there who like to let dogs lick your face, please don't. Because this is really a cross-species infection risk, and it is associated with poor oral hygiene and periodontal disease. So anyone that's got bleeding gums, that they can't get rid of bleeding gums, or really bright red gum tissue, you always got to be checked for this. I was 3 months on I guess an antibiotic that was a paste. You could just about throw up every time, and you had to use it for 3 months because you had to get through the egg cycle. It was so hideous, but we now have like a product called the Perio Mix, where it's got the pickling salt, a pure salt in there, and vitamin C, and you make that into a paste, and you can put the paste right up the top and bottom of your gums and let it sit there for 20 minutes and let it eat at any of the pathogens that you've got. And it's the cheapest way of, you know, tightening up the gums around your teeth and to kill off any nasty bugs. Trichomonias tenax is only just started to get into the University of Sydney and the Cairns University to start doing these major studies, and it's a joke because it's been around for a long time, and I just don't know why universities come up with, oh, now we're going to start it, and it's been around for a long time. I feel like we're about 20 years behind the times. In America, they're above, and the Caribbeans are above it because it's a tropical, you know, parasite. So here we go back into rediscovering the same old parasite. And anyone that's having problems with their iron, again, this is something that you've got to look into because it will drive down your iron levels. And parasites like this dog parasite, it loves to eat your white blood cells. It will eat it. It will actually suck the guts out of the cell, and it's just a ghost cell bobbing around with nothing in it. It's quite amazing to watch. And it's also vampiric, which means it loves red blood cells, and it will constantly drink your red blood cells. It's disgusting. And people are constantly sick because you've got no immunity in the saliva. So, and it also, if it gets in with a root canal or an implant, it will eat away your jawbone. So it loves collagen. So you start looking at osteoporosis here in the jawbone. And if you're over through menopause where your estrogen's low anyway, you don't want a double whammy of having something eating your collagen and not creating bone anymore because you've got no estrogen. So it becomes a problem for the elderly. Currently, there's only 2 dentists that I know, that are equipped with the proper microscope to be able to do a quick sample test to see whether you've got this dog parasite or not. There are other parasites that you cannot identify with a microscope. They are so tiny, but they are just as deadly. So yeah, it's the mouth is quite an important area to get right. So I guess there's a lot of trust issues with dentistry now, and I guess they're ignoring a lot of testing to find hidden infections. And look, dentists don't want to. There's a lot of dentists that don't want to do. Oh, now I've got to sit down and draw it all out and have blood tests, and now I take my patient through all these protocols. You could just imagine they just want to drill and bill, get out, take your money, out you get, because it takes a long time. People that come and see me and get their blood test done and then go, okay, we get it done and, you're all fine and get out back out in the world and do it again. And it's like, it doesn't work that way because you just don't know what damage has been done to your health. And when you've had surgery, 3 months later, you have to have another blood test to make sure that the infection's actually gone. How do you know? How do you know you're actually out of trouble? And how can you prove that? Like, is anyone doing any pathology just to see whether you are actually out of trouble because of what the dentist has done here? And are we tracing chronic illness back to the origin, back to the mouth? Because I know a lot of practitioners love to just focus on the gut, but where does the food start? Where does the food enter? If you're going to be eating junk food all the time, you're going to destroy the only set of bones they're the only ones that are exposed in your whole body, and you can ruin them very quickly. And this is why we want to build the whole community infrastructure around now correcting this disaster that dentistry has created. So it is a revolution, but it's a quiet one. And how much dentistry do you need? Like, this is just a mess. You can just see, and people do walk around with just absolutely everything done to their mouth and caused absolute destruction. And who can afford to have all of this fixed up? It's a lot of money. So what I've done is I've created a mini course, and it's getting people to get educated in the whole process and why they could be feeling the way that they're feeling. So it's called mirroredmouth.health. If anyone wants to do a little mini course, it goes for 40 minutes and it takes you through everything just to answer a lot of questions, because I think this step is so important before you get involved in dentistry and get involved with a practitioner who's going to take you through this whole process, because I just don't want anyone to feel uneducated around this and jump into something that they may not feel comfortable to do yet. I think people really do need the education before you jump into anything. And these are the types of shirts that we're giving out. So you get a free t-shirt if you do the course. Because we want to start the conversations going. I want to start to see what people are thinking, when it comes to dentistry, because no one's thinking on this level. And it was only a couple of weeks ago that they showcased myself as an example with dog parasites on Channel 7. This is the practice. This is the actual clinic that I work out of. I took that over a couple of years ago. It's on a private land. It's owned by a lawyer, and this is where we're here helping as many people as we can. Everything we do obviously is peer-reviewed education. So a lot of my education comes from America and Quebec and things like that for parasitology and education in pathologies and things like that. So we do have our goal set to have an on-site lab for testing for infection and toxin testing, community supported and trust-owned equipment. And we also have a support centre here for the midwives, a birthing hub with diagnostics. And also, obviously, to improve the public health campaigns for oral awareness. So the long-term vision quickly is that we want to be decentralised. I do not want to be a lab where I'm registered and that I have to answer to Medicare or anything like that. It's just not going to work. We want to do the pathologies in a way that's going to be better diagnostics for everyone. And we want to improve this new standard for oral health and to build the infrastructure so it can be passed on to the community, not to corporations for money. Obviously, it's set up as a ministry to protect practitioners and patients. And our number one focus is oral care and becomes a gateway to lifelong healing. And we have a workshop, and it's going to be a very interactive workshop. So Van, thank you, Van, for organising this. It's going to be held on the 18th of October. It's going to be held in Melbourne, in Mordialloc. So if anyone would love to attend, anyone that would love to have their blood test done and analysed and then come to the workshop, because on the second half of the workshop, we're going to be going through blood chemistries, how we're going to balance that. And we've also got the lovely Dr. Andrew Taylor, who is a biological dentist. And it's so good to come and meet a dentist and why is he doing this differently? And how is this going to affect my health? And this is what we want. We want a lot of interaction so that people can learn and take more responsibility for their health. So I can send the link to Kelly later if anyone would like to join us on the 18th of October. And we're also giving away the new toothpaste from Dr. Eric Davis. If anyone knows Dr. Eric Davis, he's created a toothpaste. He's a biological dentist, and to help remineralize your teeth, to just keep them strong as well. So we want everything to be safe and what products we can use to be safe for the mouth. And that's me. So I just wanted to say thank you so much for getting you through this, and I'm happy to answer any questions that you might have.
Oh, wonderful. Thank you so much. I do have a few questions
I'll stop.
before I open up to the floor. And that was very informative. I would love you to send me that flyer. We should actually put that on our channel and encourage as many people as possible to attend that on the 18th of October in Melbourne. That'd be amazing. I just wanted to go back to the beginning of your presentation, and I was thinking about how you became aware of, seeing through everything that is taught, that dentists are taught, and they're still passing on the old way of doing things, and better. But how did you personally see through that and start to go, hang on, that doesn't add up, that's not right? And you had an experience when you were 27, yeah. And so tell us about that, a little bit about that journey, and then also if you were able to see through it, other dentists, why aren't they seeing through it?
Yeah, great questions. Look, being at the age of 27 and so naive, I had to be explained a lot about things, because when you're given the cancer word, and 27's young, and then you're sitting in the dental chair and you have to go through so many steps of having your amalgams removed, and then you had to have the infection cut out, and then that's where the hardcore information is given to you. And when I met Dr. Eric Davis, we were friends before any of this happened, and it was just like we all went out for dinner, and he said, "Why so sad? What's going on?" And I said, "Well, I've been told, I've got cancer." And he goes, "Have you got a rotten tooth?" And I said, "Well, what's that got to do with anything? Like, I've never been told that it's got anything to do with oral health." And it just seems so foreign to even say that. And then then you're on board with all the education. And he had only just come back from America to change his whole dental practice. He wanted to stop doing root canals. He wanted to stop doing silver fillings because he wasn't well either, and his wife wasn't well. And so they started looking into it. So I guess my education came through that experience. And then Dr. Eric Davis was also hardcore learning how to change his whole practice. And I tell you what, that's a gutsy move, isn't it? Because you're actually culling back the amount of money you could make in dentistry from drilling and billing and putting all these products into people's teeth, and thinking of all the money that could come into it, to say, no, I'm not going to do that. And then how are you going to keep afloat? How are you going to pay the rent? How are you going to do this and that? Like, that must have been huge, I guess, mind shift. And also it comes with you're practicing out a scope of what the ADA is also saying, because we've approved mercury filling as safe. We've approved that root canals are safe. And if you go against that, then you're practicing on a fringe way of dentistry, and we don't like it. So then came the attacks. And I guess you will lose your license, you will lose your livelihood, and that's it. So this is what the dentists have to face when they wake up. It's when you watch the students go through Griffith University and you see them getting educated. And I did put in a formal complaint, because I saw that the lecturers were saying, oh, look at this house you're going to have. Look at this fantastic car you're going to have, this with this great business. And I said, how does that represent actual care to a goddamn patient? I said, you're putting money. It's like when you watch your goddamn patient walk through the front door, you see them as a dollar sign. I said, that's disgraceful. And I said, that's a felt thing, because you don't know who's walking in the dental who have been raped and then have to open their mouth. That people are afraid to go to dentists, and they're afraid of the pain. And then off top of that, you're seen as a dollar sign. Like, it's absolutely disgraceful. And then when you work out that the ADA and who else with the dentistry, they're funded by Cadbury and CSL sugar companies. So it just perpetuates the whole system. So poor Eric, if he was tried, and look, they did. They brought out Dr. Hal Huggins. They brought out the top notch from America to be educated and to change their dental practice. Guess what? Men in Black rocked up and started threatening their families and shut it all down. You do this, we'll make sure that your kids aren't alive. That's
Yeah,
why they
huge
shut it all
gutsy
down. And so these poor dentists who actually care and want to go home and put their head on a pillow knowing that they didn't kill anyone for the day, are now having to go underground to try and save lives. So, yeah, we have to be very careful how we move forward.
So going on to the ministry that you started, how is it run by the community?
So, oh God, it's gone through a lot of changes, because when we first started, it was a lot of fighting with APRA, with all the practitioners. It was full on. And we had to get help from people in America to write out certain letters and things like that to back them right off. But then it got too heavy on the paperwork. And as practitioners, you're trying to do all this paperwork and then go over here and do paperwork with your patients, and then it got into the courts and things like that. So I had to step right back out of this, because people started getting too down the rabbit holes with all the paperwork and jargon and all the laws and things like this. So we sort of went off at the back and stood back and went, how are we going to work moving forward now as a ministry, to basically operate under that kind of banner. And we actually, this is funny, you'll laugh, but we're actually ministers. We're actually registered.
It works.
We got a piece of paper from America, because we had to be registered somewhere to help. And so it's just thinking outside the square to play the game. and to keep ourselves moving forward, because while we try to learn how this world is operating and not to get so locked in of
Mm.
of man's law and all this kind of stuff, but to try and keep operating outside. So the ministry is a membership base. There's an NDA that you've got to sign, and we have a beautiful platform that we've set up. So it's a different platform again that we're completely out of, Facebook, all of this kind of stuff. So we're remodeling it again, and basically any of the practitioners want on there, and we're just advertising any of the practitioners on there to our database, and just making it that little tight inner circle of trust. So it's a work in progress. I'm not saying we're perfect and we've got it all going on, and it just feels like you can't get stuck in one thing, because the next level you learn something different and you go, oh God, we're not there yet. So
No, and memberships are hard, and getting community to work together is
yes,
a process.
it is.
And so it does take some time, and so people have to be really, really engaged and patient with the process. Um, so that what you said there made me think. So if you join as a member, then do you get access to professionals or knowing who to turn to? So
Yeah,
that's very exciting to come across, especially as someone who is building community and wants people to be able to have that database to know, okay, who are our go-to people. So
correct.
you've already created that.
Correct. So because it's like we've got to build the infrastructure, right? And so that's why we build the membership around the infrastructure, so that it's owned by the community. If you're a member, so if anyone goes after you and you go, well, I'm sorry, I don't own the lab equipment. It's owned by the members. So you're going to have to sue hundreds of people if
Mm,
you want to go after everyone. Go
mm,
for it. So there's not
mm.
just one person at the top. Everyone's at the top.
Beautiful.
Yeah.
So then with that Purify Water LLC that
Yep.
you can purchase, do you take it if you've got amalgam fillings? I guess the thing is getting rid of those safely, and also we heard from Professor Robin Cosford a few weeks ago about making sure that you not only know the right practitioner who can get rid of them safely, but also going on a detox protocol before and after. Um, do you take this product before or after you have root
The
canals
removal.
or
Yeah, if
amalgam
you're lucky
fillings?
enough to get it and you can afford it. What we did with one patient is that they took about 250 milligrams a day leading up, a couple of days leading up to seeing a dentist that actually knows how to remove amalgam fillings. He's actually got a little machine that tests each single mercury filling to see which one is the most deadliest. And he removes
Mm,
that one first. So it goes in a sequence
mm,
based on what's emitting the most. And so he did this to one of my friends. He had 2 days in the dental chair because he had a mouth full of mercury. He took the OSR throughout the process of while the mercury was getting removed. We did some more blood tests, and my goodness, it showed a massive difference to his blood chemistry markers that were really highly flagged. It was almost like, oh my God, he doesn't have mercury poisoning.
wow.
It is just amazing, amazing stuff. So not everyone responds terribly to mercury, but the ones that do, the real sensitive people, they go really well on this product. And look, for me, because I never got it in 2010 because I didn't know about it, and then I got it a couple of months ago, um, noticed another massive change in my energy levels because
Mm,
it stores in your bone tissue. And you've got to get your patients to do really heavy weightlifting to start releasing it out of your bone tissue, because that's where it stores. And you're going to have to get your bone tissue turning over to get it out.
mm.
This
So,
stuff sticks.
so literal lifting weights will
Yes, you have to
mm,
do heavy weights.
wow.
So basically, even with people that got mercury constantly coming out have a lot of candida problems as well, because candida, a pathogen, loves mercury. And it can actually change the biochemistry of mercury into a deadlier form. And then it just goes everywhere and then creates more havoc in the patient. And these parasites can actually sequester the mercury. So it's amazing what a parasite can actually do with mercury and then drive it in.
Now, I know there's some questions in the chat, and
Yes.
Rhonda, you've got your hand up. But before we go to that, and you've just mentioned parasites, when the dog has the parasites and then they transfer to human, is it called the same thing? Is it called something different once it's in the human? Like we get treated for threadworm and roundworm and ringworm. Is there something else? There's like lots of different other ones, I suppose.
It's really interesting because Trichomonias tenax is very similar to Trichomonias vaginalis. You know, that STD that you get, the women get. And but the Trichomonias tenax parasite is specifically with the dog.
Hmm.
So it's like we're getting attacked by both ends, really. It just goes everywhere. But the Trichomonias tenax is a parasite, but there could be different species coming out now. And this is where we're lacking diagnostics here in Australia to work out the different species. But the dogs will have it, but you can get it off horses, the same parasite. And you can get it when you're swimming in lakes, creeks as well.
Hmm.
Yeah,
That's awful.
I know.
What procedures can we comfortably allow our regular dentist to do?
Well, I guess when they're doing periodontal disease and they're cleaning, doing the real harsh cleaning to really get rid of the plaque and that, I think it's going to have to come back home more with you getting off packaged foods. Do not eat packaged foods. Anything that's sitting on a shelf for more than a couple of years or whatever, don't eat it. Don't eat grain. Do not eat toast, things like that, because you're feeding the infection. And parasites love all that kind of food.
Mm.
So
Mhm.
people don't even actually know what to eat now if it meant if we just focused on looking after our teeth. Because at the end of the day, if you go and see a biological dentist, they're going to know exactly what you ate. And you
Mm.
can't lie. You can't. They just
Frightening.
it's very good. They've if they could just use their skills for good and not evil, it'd be fantastic. The populace would be amazed. Amazing health.
Now I'll
But
let you go to some of the
yeah,
questions in the
please.
chat because so Rhonda's got her hand up. She's been.
Hi, Rhonda.
Hi, Simone. I've got so many questions, I don't know where to start. But, and I do have a big story about amalgams and oral health problems, which I may or may not share. I'm happy to share it, but I don't want to take up too much time. But my main question, I guess, when I think about all the things that are rolling around in my head, is about the dog parasite. Is that treatable just with a normal parasite cleanse, like, or is it
No.
something very specific?
Very specific because you're going to have to go back to the dentist and have the deep pocket cleans. You're going to have to change your diet. You're going to have to get on products like this powder and brushing solutions and everything like that, because it's actually a protocol. And you're going to have to prove yourself to the dentist that you've been doing that. If you go to a really good biological dentist and they'll go, you haven't been doing that, because they'll know.
Oh,
And we've got to stop the bleeding of the gums.
yes, yes.
Yeah, so all of that. So there's a bit of a process to get you through, and dietary is like 90%
Mm-hmm. Yeah.
dietary. And then because the dog parasite would have done a lot of damage, and we're going to have to get the bone healthy again and strengthen your bone tissue as well. So it's just not a quick walk in the park.
Yeah. Well, I'm just assuming that I've probably infected with it because I've got dogs, but I'm not.
Yes.
I'm not in bad shape right now. I have been in chronic shape because of my teeth. I thought I was
Yeah.
dying, and I literally was. But I've restored a lot of that
Yeah.
because fundamentally, before all that happened, I had good health. So I guess you know, that helped. I didn't have any sort of underlying conditions before I had all this oral stuff. I had a mouthful of amalgams. So I'm not in bad shape, but I'd like to be better than I am. So I'm just sort of thinking to myself, well, the fact that I've got dogs in close proximity to me, I'm wondering, just listening to what you said there tonight, whether I shouldn't investigate that a bit further. I mean, my gums are nice and pink now.
Yes.
I don't have bleeding gums. I had when I got all my root fillings extracted. Oh, what a journey that was! And my regular dentist thought I'd lost the plot because he'd just finished putting the last one in when I became informed about what was really happening to me. And I paid him the respect of asking him would he support me through having them extracted. Well, he just about tore the ceiling off his surgery at how ridiculous that I would even ask him that.
Yeah, because you're actually hitting on their dollar signs.
He said to me, but he said, you've just paid me over $7,000 over the last 18 months to do 5 root fillings, and you've got another one to do.
Yeah.
And he said, now you're asking me to pull them all out or to support you through a process of getting rid of them. It was a really interesting thing. But anyway, I just moved on, and I had them all extracted in hospital with a oral surgeon and had the sockets cleaned out. It did turn my health around almost immediately.
Yeah.
It was just a profound, because I really was in a bad way. And I was blaming menopause. And while menopause was part of the issue, it was just another layer of stress that came upon that situation before I became aware that it was the underlying oral health problem that had really tipped me into the abyss. And so, but anyway, I'm not in too bad a shape.
What you could do is actually get some functional pathology done just to make sure that the infection's gone.
Yes, and I wonder if it has gone, because I'd like my energy to be better. I feel as if it should be better than it is, because I've never been the same, and I've always had this dream that I could be better than I was, and so I just wonder about that. So I'd love to. So whereabouts are you, Simone?
So I'm located on the Gold Coast, but I can look after anyone anywhere. We can get the pathologies done anywhere. And then I do a full 9-page pathology report. You'll get a health journal and a review of everything just to see where you're at. Because what we found with a lot of people that just get their root canals ripped out, their implants ripped out, but they were never prepared for surgery. They'd never got their iron to the levels before they went into surgery. And then what happens is if you eat any sweets after surgery, because you've got 3 months after surgery that the infection will go running around freely because you've just removed its house. So where's it going to go? So just because you cut it out doesn't mean it's gone. It's actually still sitting systemically everywhere throughout your body.
Yes.
And so I've had patients where they didn't do the right thing, and basically the infection stood and so did the disease. And they came out into secondary diseases.
Well, when I was at my worst, I actually got oral lichen planus. Which is such a painful. I just really wanted to die when I had that. It was on my tongue. It was all around my gums. And for those that don't know about it, it's a highly inflammatory condition.
And you've got to, that's why prepping and planning really is important, so that your healing is so much better after dentistry. And I just saw someone put up in the chat, Eric Davis. So Eric is at the moment on hold at the moment because he's trying to find extra dentists to work with him. But when you've been flagged as a fringe dentist, you don't want to lose your license if you're associated with anyone that does that. So it's been really hard to find really good dentists, because at the moment I'm getting to the point where I'm going to have a waiting list because I'm not getting enough dentists that are prepared to do whatever it takes for their patients.
No, that's, I can
No,
imagine.
it's always going to be a dollar sign. We need to move on to Van. Van, if you want
Sure.
to.
Thanks so much, Simone.
Thank you,
Rhonda.
Rhonda.
Thank you very much.
Hi, thanks. Thanks, Simone. That was a really good presentation. I just wanted to let people know my little journey meeting Simone. I was diagnosed with breast cancer in October 23, and I posted in the naturopathic student mentoring page to say, you know, my bloods are all fine, everything's fine. I've been given these herbs. And so Simone reached out to me and she said, Van, send me your bloods and I'll have a look at them. And I did, and I said to her, "There's nothing wrong with them. All the lab results came back as normal. The labs came back normal, and she said, "Oh, just send them back to me, and I'll have a look at them for you." So I sent them off to her, and she sent me off for some other tests as well. And she said to me, "Well, you know, you've got anemia. You're anemic. You've got mercury toxicity, and you've got pesticide toxicity, and on top of that, you've got calcium leaching out of your bones." I went, "What the?" Right. So she got me to have some more tests, and she said, "Have you got a dead tooth in your mouth? You've got mercury." And I said, "Yeah, I've got a dead tooth right there." But the dentists over the years have said to me with x-rays, OPGs, nothing's wrong. The root's still there. It's just a dead tooth. Leave it. So she said, well, use the meridian map and follow it where it leads to. So I did. I went and did. And it went to my stomach and up to my right breast where the cancer was. So I had to be prepped to go and see Andrew and had the tooth removed and the fillings replaced and going on a very strict protocol. And 15 months later, free from cancer. So I put all my clients through this whole process now. And Simone, I've just followed her to the nth degree because it's so true. And I'm one of the results that came through that was a success. So yeah, so I've basically got her to come down in October to share this with people down in Melbourne. And it's you just cannot close your eyes now that you know where it all comes from.
Amazing. Thank you for sharing your
Thanks, Van.
story, Van.
Thank you, Van.
Thank you. Thank you for
Fantastic.
listening.
Really great result. And for anyone who's, concerned and going through there's a testimony for you. Did you want to check, Simone, any of the other questions in the chat?
Yeah, there's farmer Joshua quoted 6,500 to have a plate on my teeth to lower the palate to help me to nose breathe rather than mouth breathe. No way in hell would you spend that much money. That's disgusting.
Dentistry is expensive anyway, but is some of the processes that you've been talking about, are
they're all
as
made up.
expensive?
There's just too much interference, especially on children. They didn't have to do that. They don't have to do half of these things that they've made up.
Okay, so I've just had my kids, the dentist recommended that their teeth were fine, there were no fillings in their teeth, but sometimes where there's lots of crevices, they want to fill in the crevices so that
Don't do
is that
that.
a safe
Don't do that.
process?
No,
No.
because how old's your children?
Teenagers.
Because my daughter had the same thing and they wanted to, compact it all in and I got to get rid of these crevices and her mouth just grew. You got to let the children's mouth grow. And if they're starting to get narrow and things like that, that means they're mouth breathing and you're going to have to somehow keep it shut with some stop snore stickers and things like that so that they stop snoring or mouth breathing because it causes cavitation. So yeah, just make sure that they're not mouth breathing at night. Sneak in on them and just watch them and see what's happening there. And get off any kind of cereals for breakfast. It's always lamb chops or eggs and good old-fashioned farming eating.
So eating more meat is good for the palate?
It's good for the teeth because they're protein structures. And so you can, a biological dentist can see how much sugar you're eating because they can see the recession of your gum receding away from your bone, your teeth. It's all diet. It is 100% diet. So, you can tell a lot by a person by their eating. So do not eat bread, whatever you do. I don't care if it's keto bread, just don't touch it. But yeah, I'm just going through all the questions here, but I would be definitely, Joshua, you're in WA. There's an Ozone natural dentist over there. I think they're you might need to go and check them out if you can. They're called Ozone Dentistry. I think I'm going to get in touch with them because I think they're a bit more alternative. There are saliva tests coming out and heaps of this in America and overseas where you can do a lot of testing of your microbiome. Everyone's getting into the microbiome thing now. So yeah, a lot of those are coming out, but at the moment, more dentists are learning to have the microscopes in their clinics so that they can start doing proper swabs where you don't brush your teeth for 24 hours, so it's filthy, and then let them do all the microscopic testing on you and see where you're at, which is good. This is a start, right? 10 years. Ivermectin, everyone loves. I love ivermectin. I did some of my experiments at Griffith University up at Nathan, and they were specialists in parasites, and they were Nepalese, actually, some of these scientists, and they were just shocked that ivermectin was getting shut down in Australia because they said, yeah, every time we go back home, we just pop an ivermectin and off we go. It's just part of our routine kind of thing, but you can't.
Do you need a practitioner or a protocol to help you detox parasites, or is it just as simple as popping an ivermectin?
No, because the thing is, if you've got periodontal, it doesn't matter how many times you can pop or do things, you've got to make sure, number one, the diet has changed. Number two, you're going to a professional to clean all this up. Number three, you're going to have to go on a specific antibiotic, especially if it's a dog parasite, because you can't just use ivermectin. It may not. I know I couldn't use ivermectin. I know I had to use specific antibiotic for that parasite, and it had to be killing off the egg. So it's 3 months. So this is why everyone's jumping on the parasite bandwagon, but then not realizing that their patients or anyone's got rotten teeth where the goddamn parasite's going to, even Lyme disease is a parasite. It hides in rotten teeth. So this is why no one's actually getting ahead with their parasite cleaning.
And what about braces? Do you recommend or not?
No. If they're metal braces, you're going to get nickel off it and you're going to have heavy metal again. And so basically, if you're going to do braces, make sure it's not an environmental poisoning one that the kids, because I noticed that a lot of kids are getting the nickel one and having massive nickel poisoning and disrupting their hormones and disrupting their periods and everything. It's terrible. So you've got to be really careful what product, even if you do need to expand palate out, there are safer products out there.
Okay. Well,
there's especially to get rid of worms. Eric Davis, yeah.
Now, what should people do if they have more questions, if they want to reach out, if they need professional help? How do they reach out, Simone, and how do they get in touch? Do they need to join the PMA to get help?
What I'll do is, did you want me to send you some information and the flyer for October and you can send it out? Would that be the best way?
Yeah. But also for those who are not living in Melbourne who can't access that particular.
Yeah, so if you can't come to Melbourne, we do have an online mini course as well. So, and you get a free shirt.
And how much is the mini course?
It's $149, and there's about 6 different T-shirt designs, and they're fantastic because it actually asks a question, ask me why, or something that you know, things like that, gets the conversation going because you've actually now been educated, so it'd be good to keep the awareness going. So yeah, the mini course is $149 and you get to choose your T-shirt. We've got constant workshops going on, so we'll continue on with those each year. And just send my email address, I guess. They can, if they want to contact me direct, I'll, my email address as well.
Okay, so if they want to join the mini course, they should contact you via the email?
I can put it up here now. This is the mirrored www.mirroredmouth.health. That's for the course, if they want to do the program. Yep.
www.mirroredmouth.health.
And if you want to contact me directly, that's my email there.
SLSLEEP at protonmail.com.
protonmail.com.
Beautiful. We'll make sure that we put those links in the description. Beautiful. It's been a huge amount of information tonight. We've all learned something new, and there's so much more to it that we could learn. We'll have to have you back again, Simone, and do another deep dive. But in the meantime, everyone get on and do that course, the mini course, Mirrored Mouth. That sounds like the next place to go. So thank you, everyone, for joining us.
Thank you so much. Yeah, thank you so much for having me on and just to share my story. Thank you.
Pleasure. And next week, jump back in because we're going to be talking to the experts who are coming to the Freedom Summit. We're going to have a bunch of different people on who are going to do a little spotlight each. So you'll hear from a lot of different people all in a short amount of time. So do jump back in and join us then. And if you are not in a Telegram group, go there, go to My Self-Reliance on our channel or Self-Reliance and Food Storage, our chat group. You can find us on the website, myselfreliance.com.au, and get your tickets. It's a free entry to the Freedom Summit if you just want to roam around and enjoy all the free activities. Or if you want to hear from our speakers, it's $60 for the whole weekend or $100 if you want to camp and stay on location as well. So look forward to seeing you all at the end of October. And Simone, if we'd met before, I'd definitely have you on that speaking roster, but we'd love to have you on the show again. So thank you so much.
Thank you so much. Thank you.
Okay. Good night, everyone.
Bye.
See you next week. Bye. Welcome to the My Self-Reliance Freedom Summit. It's so good to have you here. We have had a cracker of a weekend and it's not over yet.
Very honoured to be invited to come and be a part of this and get to speak and share some information about what freedom means to me and how we can help others learn to attain it.
Hi, I'm Connie. I'm a visitor here today at the My Self-Reliance Expo with one of my boys. He's having a ball, I'm having a ball. The stalls are fantastic, the speakers are awesome. I've certainly learnt plenty along the way from, everything from gardening to spear throwing.
G'day everyone, my name is Murray and I am the owner of Country Meats Direct, which is a home delivery service in Sydney that specialises in free range meat. The reason I came back, I've been here twice now, is because how nice everybody is.
And a massive thanks to Kelly and the crew for organising this event, giving a platform for all of us to come and share our views and ideas and opinions as to what freedom means to us and how we can help share that with others.
And it's a beautiful location to boot. If you're looking for community, if you're looking to be educated on, being more traditional, being more self-reliant, then this is certainly the place to be. It's just done in a very connected way.
It's an amazing community. Kelly does a wonderful job and the people here are the sort of people I want as customers, so that's why I'm here.
What does becoming your best self mean to you, Kelly?
It's pushing beyond the boundaries, knowing myself as where my limits are, and then pushing beyond that to where I want to be. How was Michelangelo be able to create David? He just took away everything that wasn't David until David appeared.
If you're considering coming to the event or joining the community, it's really just about being around good people that share similar values. And that's what life's all about. Life gets stressful, life gets busy. When you do have a bit of free time, you want to spend it with people who are going to cherish and value that time. And these are the sort of people that do that.
If you are a community group, these events are gold and worth their weight in gold to come and attend. You get to connect with other like-minded people. Great event. My Self-Reliance, if you're not here, we'll see you next year.
At My Self-Reliance, we're all about bringing communities together. Every month we like to hold workshops to teach you how to be more self-reliant. But if you're not in Sydney, you could be missing out. We're going nationwide. We're teaching you how to bring My Self-Reliance to your community. So if you want that too, reach out to me. I'm Kelly Wilkins from My Self-Reliance.